we can immediately.
Are you serious? We have breaking news
we're going to have to take care
that
of. My first step is
the Secretary of Veterans Affairs,
get him an appointment.
Eric Shinseki,
Let's figure out how we can surge some doctors in there to make sure that they're getting
Shinseki. It doesn't have an N in there. He's
to
just
do
resigned,
then
okay?
is that
He resigned. And the President of the United States is, as we speak, here in the last 8 minutes, is right now still holding a press conference.
Getting an appointment scheduled. And let's have a realistic time for how soon they're going to get an appointment. Those are things that don't require rocket science. It requires execution. It requires discipline. It requires focus. Those are things that Sloan has. There are then going to be some broader issues that we're going to have to tackle. The information systems inside the VHA. Those are probably going to have to be changed. That will cost some money. That will take some time, and it will have to be implemented. I think there are going to have to be some changes in the culture within the VHA because, as I said, they're providing very good service, medical treatment to our veterans when they get in the system. But they don't have, apparently, the state-of-the-art operations that you would want to see, for example, in a major medical center or hospital. Now, keep in mind, those of us who are outside of the VA system and try to get an appointment with the doctor in the private sector and try to get an appointment for a schedule for a hospital visit, there are probably some wait times as well. So part of what we have to do is figure out what are realistic benchmarks for the system. And my suspicion is that with not only all the veterans from Iraq and Afghanistan coming back, but also the aging of our Vietnam vets who may have...
Okay, let me help the president out. He said, the veteran system, he's basically saying we're going to need to spend a ton of money. No, we don't. We need to list... He just said government health care with the veterans don't work. It's a disaster. It's a literally minefield. It's horrible. He admitted that the private sector does much better, but hey, I got an answer for you. Don't wait. So we may have to retrofit stuff. Don't still do it. Stop talking about spending money on this. Shut it down. Here's what you do. You just take a key. If you get a key, take a key, go to the front door of every veterans hospital in America, and turn the lock to closed. Hang a sign that says closed. Go to any hospital you want to in America, take your veteran card, you will be immediately accepted. Just turn all the veterans loose and tell them to call any doctor they want. If you like your doctor, you can keep your doctor. Just call any doctor you want. Tell them you're a veteran. Show them your veteran credential. Get an appointment. Go see the doctor. If you need to go to the hospital, put you in any private hospital. And the government doesn't have to spend a dime. All they have to do is pay the bills for the medical care of the veterans. And they've got plenty of money because they've even said they've brought in over 75% more money for veteran medical expenses over the last 6 years than they ever had before. Yet that money just sitting there because the veterans can't get a doctor's appointment. They can't get to see the doctor. It's real simple. Lock the door. Turn them loose. Let them go to the private sector. Because, folks, if this is how government handles your health care as a veteran, then what do you think you're going to get under Obamacare? Okay? All right, anyway, breaking news. The Shinseki, I think that's how you pronounce his name, Secretary Shinseki has resigned. And there will be a new secretary chosen. His name is, Obama says that Shinseki has served with honor, but the secretary told him that the agency needs a new leadership, so he's leaving. So the president named Sloan Gibson, currently the deputy VA secretary, to run the department. Let's grab this. Nothing's gonna change. Shut them down and turn them loose. Go back to the private sector. Less government is better. We'll talk about today in our live broadcast. It starts in a few minutes. God bless.